Noblesville woman is concerned about her son's future if Congress ends funding for therapy and treatment. Tonight, she and Governor Holcomb are asking Congress not to slash Medicaid funding for the states under the proposed health care plan. RTV6 State House reporter Katie Hines is live to explain. Katie?
Erica, this Noblesville mother says everything is on the line for her son, and she's taking her story to Indiana's congressional delegation, also sharing it with us as a way to show that she doesn't want to see this funding slashed. This comes as a nonpartisan report shows $800 billion in savings over the next 10 years due to reductions in Medicaid. Marty Stone is keeping up with the debate over the proposed health care changes. Her 12-year-old son, Robbie, is autistic and lives with a form of dwarfism.
He's got this smile, and he loves life. He loves to dance around. And I'm not quite sure how he does this because he's got a walker and a wheelchair.
Stone's family is insured through her husband's employer, but she says a Medicaid waiver fills in the gaps for Robbie's treatment, covering everything from the equipment he needs to prescriptions and copays for appointments with specialists and occupational therapy.
It helps his quality of life. It helps him be more independent. It helps him to get healthier.
But she's worried what could happen if the option is taken away.
Without it, he could die. If we would lose the Medicaid waiver, we may have to make the choice of, do we treat this? Do we not treat this? You know, do you pay your mortgage?
In a one-on-one interview, Congressman Luke Messer tells me the House GOP bill is aimed at giving Indiana more flexibility to manage Medicaid, specifically the expansion of the program called HIP 2.0.
The details will matter. We're still working through that as the legislation happens, but it is certainly our goal to encourage more states to create a plan like Indiana's, and we want to make sure Indiana's plan has the ability to continue to thrive and survive.
This mother says she'll be watching. And Congressman Messer, in that interview yesterday, had said that he expects changes still to this proposal, especially as it goes over to the Senate side in Washington. He says that he thinks some of those changes will be to Medicaid, so it's something we will continue to watch. Reporting live downtown, Katie Hines, RTV6.